I look back on this year, I can say that some things didn't surprise me. I knew this was a remarkable scientific institution. What surprised me most is something which I think most of us who came to leadership positions this year would say, is that it gives you a sense of the resilience of our people. It's tested us in ways that I don't think any of us could have ever predicted. I don't think any of us in our families ever expected the kind of stress and the kind of pain that we feel emotionally by being separated from the people that we love. It stressed us at the workplace in ways that changed the way we work, that prevented us from being together. Humans have an incredible need for connection. It's something which is clear in humanity over time, and I can tell you it's one of the things that makes working in the cancer field so rewarding. The connection as a doctor that you have with a patient, the connection as a scientist that you have with the people you work with. And what struck me this year is probably the most surprising, is how we showed we had the resilience to still endure, continue, move on, and find those small moments of joy, those small moments of connection during the year that we all found a way to have. There weren't many. There were far more times when things were challenging. When COVID came along, it gave an opportunity for many of our virologists, as well as many of our cancer and basic science researchers, to become more involved in looking at how we responded to this. It started with our work in molecular epidemiology and genomic epidemiology, the work of Trevor Bedford, Betts Halloran, and others who became very important in describing the nature of spread of the virus early on. And then finally, something I think we're still in the midst of right now is the development of vaccines. The establishment of the co-VPN here at the Fred Hutch was a remarkable accomplishment. The ability to take the inner workings of the HIV vaccine network and to be able to transfer that to COVID. There was a remarkable amount of work and effort and expertise that went into this. It was certainly not effortless, but it appeared seamless with the speed with which we were able to get that up and going. And the co-VPN has played a remarkable role in bringing vaccines to patients. One thing I think we can all note is the role that the Fred Hutch has played in educating people about the pandemic. We have worked on education initially about the nature of spread of the virus. Then we worked on talking to people in the public about what we can do to protect ourselves and to protect our loved ones and to protect our city and our region and our country from spread. And finally, I think an area where we're playing a huge role now is in spreading information about vaccines. We've been extraordinarily lucky at the Fred Hutch to have the supporters that we have in Seattle and nationally. One thing I've been struck by is how when I talk with donors to the Hutch and people who support the Hutch philanthropically, they understand and they get it. They understand the importance of why COVID is a threat, not just to our society, not just to our region, but also to cancer patients themselves. In the same way that they've supported the work in HIV, they're supporting the work in COVID. So we've been the beneficiaries of remarkable generosity. Cure Start Here is a very important part of the way I think about the Fred Hutch. It's one of the things that attracted me to the Fred Hutch a year ago, that made me think that's a place where things can really work, a place that's committed to cures. I think about work that happened this year that did not stop because of COVID. Laboratories throughout our entire center have remained remarkably productive despite the limitations that the virus has placed on us as a workplace and as a culture. I've been very, very proud of the efforts of graduate students and postdoctoral fellows and staff scientists and PIs to advance our cancer mission. I've been incredibly proud of what happens at the Seattle Cancer Care Alliance, the connection that we have between the Fred Hutch and the SCCA to take care of patients. And there's really no better example of that than the establishment of the new Vaccine Administration Center here in the Arnold Building, of SCCA nurses, Fred Hutch doctors, Fred Hutch nurses, SCCA workers working together to provide vaccinations to the scientists and doctors and nurses and staff of our institutions, but most importantly, to our patients and to the community. Great example of collaboration and great example of a commitment to cure for cancer. Diversity, equity, inclusion is an important pillar on which the Fred Hutch stands. And the reason that it matters to me and the reason it matters to the Fred Hutch is for two reasons. One, it's the moral and just thing to do. And the second, it's absolutely inherently tied to the success of our science. When you think of the diseases that we pursue at the Fred Hutch, cancer, viral disease, these are diseases that disproportionately hit people of color, people in different socioeconomic groups are disproportionately harmed by cancer and by viral diseases. So if our mission is to eliminate suffering from cancer and to find cures for cancer and viral diseases, disparate impact and the way that cancers affect different populations, we've got to understand why, and we've got to reduce that impact. Because if you can cure cancer in one group of people, why not look at why those same cures are not working in other groups of patients? Is it because of access? Is it because of lack of ability to participate in clinical trials and benefit from new therapies? Those are the kind of things that we're looking at in the science of the Fred Hutch, both for cancer and for viral diseases. So I would say the one thing that this year was so important to the Fred Hutch is a recognition and a recommitment to the pillar of diversity, equity, and inclusion. The establishment of Dr. Paul Buckley as the Chief Diversity Officer of the Fred Hutch was a big development for us this year. And the work that Paul, his team, and all of us are doing together is going to make a big difference, not only because it's the right, moral, and just thing to do, but because it's also important for our science. For the year ahead, I see a time of emergence for us. So I think that the first 6 months will still be very important to delivering vaccine to the people who work here, delivering vaccine to the patients and our community. We'll still have to practice masking and social distancing for at least 6 months, if not for the whole year. But as the year progresses, we'll be able to bring our society closer and knit it back together. Sporting events. I'm a huge sports fan. I can't wait to go to see the Seattle Storm play. I can't wait to see the Kraken play in the new arena. Those kinds of experiences will be ones that I think we're going to see this year. Probably not in the very beginning of the year, but I think we're going to be seeing more of that happen. But throughout this year, the commitment to curing cancer, the commitment to changing how we can do with these challenging diseases is something I'm convinced is not going to waver here at the Hutch. And we're going to continue to look at new avenues, new science, and advancing our work in a way that will make a huge difference for humanity.